I was wrong about vitamin D. This hormone has a direct impact on all stages of life, from the intrauterine phase to old age. But what if for years the recommendations we professionals have given were wrong? And what if the studies we used to guide millions of people were designed for something else? What is being hidden from you? Are they playing with your health? As a doctor who has been studying vitamin D for over a decade, I still have many questions about it. But I also have some answers that I want to share with you today. Imagine easily raising your vitamin D to levels that protect against chronic disease using its immune and anti-inflammatory benefits. Is this possible, or is it just a utopia? Today I'll help you get some clarity. Do you need to worry about your vitamin D, or is it not as important as we thought? By the end of the video, you'll know everything you need to use vitamin D correctly and take advantage of all the benefits it can give you while avoiding the risks. First, understand what a vitamin is. Vitamin D is a corticosteroid with pleiotropic actions. Wait, did you say steroid? Wasn't it a vitamin? No, a vitamin is a molecule that your body can't produce, and that's why you have to get it through food. You don't produce vitamin C, and that's why if you don't eat anything that contains vitamin C, you would eventually suffer the serious consequences of scurvy, just like what happened to Magellan's sailors over 500 years ago. Your body makes vitamin D, but you can also get it from certain foods. Only 10% comes from your diet, so where does the other 90% come from? Ultraviolet radiation triggers a biochemical change in your skin's vitamin D precursor. 7-dehydrocholesterol turns into pre-vitamin D, then quickly becomes vitamin D. It must then be activated in 2 steps in your liver and kidneys. Other cofactors are required for these activations, with magnesium being an important one. Do you remember? Calcitriol, the active form of vitamin D, binds to chromosome regions and regulates over 1,000 genes involved in hundreds of health and disease processes, including cell proliferation. Is that why vitamin D is so important? But starting with the 2024 Endocrine Society guidelines, everything changed. The authors took a stance that almost encouraged us to forget about vitamin D, and of course, this triggered a cascade of responses throughout the scientific community. And what came next cast doubt on everything we wanted to know about this hormone. But the biggest controversy regarding vitamin D lies in the fact that a sector of the scientific community claims that we've gone overboard measuring vitamin D, and that the cutoff points established to determine its deficiency or sufficiency are too high, or even worse, the cutoff point is poorly defined. Well, the same group usually argues that vitamin D isn't that important beyond bone health, since in clinical trials it hasn't been shown to reduce the risk of chronic disease. This conclusion brings serious problems, which we will discuss shortly. However, many other professionals find this message completely incomplete, or at least reductionist, if not dangerous. And I'm going to explain why. First, clinical trials may not be the best tool when we talk about vitamin D, although clinical trials are generally the gold standard. In terms of scientific evidence, vitamin D is not a drug, it's a micronutrient, and the conclusions provided by the clinical trials done so far are incomplete. Why? Pharmacological clinical trial designs, as I said, don't work well with nutrients. There is no true placebo for vitamin D, and baseline exposure always varies in all participants, because all participants get sun exposure to a greater or lesser extent. Vitamin D acts with tissue thresholds. The benefit appears mainly in deficient people, so if you recruit participants with baseline levels above 30, it's unlikely you'll detect an effect. Low or moderate doses are often used in clinical trials which do not raise levels to protective ranges. Therefore, classic clinical trials often underestimate vitamin D's effects. An alternative is to consider prospective cohort studies of Mendelian randomization and conduct new, well-designed clinical trials. Even look at these barriers. Is current trial evidence enough to recommend it for specific groups like prediabetes or type 2 diabetes? Second, our knowledge creation model still focuses on treating disease rather than preventing it. The main incentive in research is still to treat chronic diseases with molecules that have proven effectiveness. That's why most guidelines focus only on clinical trials for that purpose. In less obvious ways, if we view it through the current model. Third, no one agrees on the optimal levels of vitamin D. The main clinical practice guidelines agree on what the cutoff points are that they indicate. insufficient amount of vitamin D in your body, that is, the levels that would facilitate and cause a health problem. We define severe deficiency as under 10 nanograms per milliliter deficiency as under 20 and insufficiency as 20 to 29. Sufficiency is between 30 and 100 and above 100 nanograms per milliliter. We define potential toxicity, meaning those would be potentially toxic values. But the thing is, no society to date has reached a consensus on what the optimal plasma concentration of vitamin D is to prevent chronic disease beyond the bone. In that wide range of sufficiency, which goes from 30 to 100, you might wonder why. For many reasons. The first is genetics. The optimal levels of vitamin D are probably very different for each of us due to genetic contribution. In fact, two people with the same theoretical exposure to vitamin D can have up to 20% higher or lower levels in their blood tests depending on their genetics. That is doing exactly the same thing in terms of environmental exposure. Pedro could have 40 and Laura could have 32 or 48 in the most extreme case. You also need to ask optimal for what? What we've been seeing lately is that different levels offer protection for different problems, and I'll tell you more about this at the end of the fourth. Criticizing the current cutoff points goes against much of the evidence. Do you know how normal levels were determined? Is the reason most people are vitamin D deficient, even with sun exposure hidden here. Dr. Michael Holick, author of The Vitamin D Solution and one of the leading researchers on vitamin D, widely promoted the idea that vitamin D deficiency is a silent pandemic. He did this based on a study of about 600 adults. He saw that no one with over 30 mg of vitamin D had osteomalacia. And that parathyroid hormone started to rise when the levels dropped below that number. He proposed that cutoff, which remains the threshold for insufficiency today. That's a smart observation, but it's incomplete. Parathyroid hormone is one hormone that regulates calcium and phosphorus. Does lower vitamin D in blood and tissues reduce calcium absorption in digestion? At that moment, the parathyroid glands, which want to keep blood calcium stable at all costs, become alarmed and start producing parathyroid hormone. To do what? Raise blood calcium by taking it from where it's most abundant, the bone. That's why vitamin D deficiency leads to secondary hyperparathyroidism, osteopenia, and osteomalacia. And that's why we need to correct vitamin D first whenever we see high parathyroid hormone levels in a blood test. All the scientific societies initially followed Dr. Holick's advice, promoting widespread vitamin D testing and supplementation. Later, however, they reversed course, advising against widespread testing and supplementation in people with levels above 20 or without deficiency. That's exactly what we explain and counter-argue in this other video, which I highly recommend you watch. So what do I still stand by, and what would I change regarding my previous position? To what level should we raise vitamin D? Can we dare to make a recommendation? What you're about to see are ideas I developed over more than a decade of study, not just simple conclusions. Many mistakes. Some contradict what I believed, others confirm it. Why is vitamin D still important for prevention? That's how science moves forward, changing when the evidence demands it. And at the end, I'll tell you the essentials, the optimization ranges that really matter. I still maintain that the current approach to vitamin D remains osteocentric, and that makes it impossible to fully develop its potential in preventing chronic disease. Also, that the current research model underestimates it. I still believe vitamin D has great preventive potential, but it's not well understood. It's vital for prenatal health, brain function, immune regulation, pregnancy, cancer prevention, and cardiovascular health. I still believe most clinical trials on vitamin D for primary prevention are flawed and offer little value. Even considering only clinical trials and ignoring other factors, researchers have conducted post-hoc analyses of these trials. And there are also analyses of these trials by researchers and post-hoc analyses of these trials conducted by, and also hoc analyses of these trials conducted by researchers. And there are also trial analyses, there are post-trial analyses, there are trial analyses, ad hoc analyses, and post-analyses of these trials. Researchers use terms like silent pandemic. For what? To gain visibility to sell supplements. Yes, that's true, but most people in the West won't experience symptoms from vitamin D deficiency. However, it's still important. Prevention is usually silent. However, hypovitaminosis D with levels under 20 raises disease risk beyond just bones. This is a causal, not observational statement. During acute illness, like a respiratory infection, levels drop rapidly, and this is not due to lack of sun exposure, but rather because the body uses the hormone to deal with the threat. Would this explain at least partially why clinical populations who are ill have lower vitamin D levels even with sufficient sun exposure? It would also explain that when the body has to respond to a deviation from homeostasis, it relies on this multifunctional hormone. This view of the hormone lets us see it as a health buffer, an added barrier against chronic disease. Vitamin D is especially important for vulnerable groups who can take it empirically: children, pregnant women, people with prediabetes, and those over 75. Even the most conservative and non-interventionist groups agree on this. If your levels are below 30, I would supplement with 2,000 units daily for at least 2 to 3 months until reassessment. And why this specific dose? Because it's considered enough to keep you above 20 and 30 nanograms per milliliter. Over 99% and 90% of adults, respectively. If your goal is higher, you need a larger dose. I'll explain soon. This is just in theory. 20 to 30 minutes of sun exposure on at least 20% of your skin without burning can produce up to 10,000 units of vitamin D in people with intermediate skin types. In practice, it's a different story, and very few people actually do this consistently every day. If supplements are needed, avoid large monthly or quarterly doses. I prefer daily or weekly dosing. They reduce dosing errors and offer better bioavailability. What you can do is take a loading dose for 1 or 2 weeks to reach your target range faster, because sometimes vitamin D takes a while to increase. If you supplement, take it with a fatty meal, add avocado, olive oil, or nuts. Adding magnesium and vitamin K2 to your supplementation is something that should be done routinely. The first helps activate it, and the second properly redirects calcium to the bones, preventing vascular deposits, which are very dangerous. That's why Full Gas uses a formula with these nutrients. Monitoring is indeed necessary when we supplement, especially with higher doses, since vitamin D toxicity and hypercalcemia can occur, and it's not that uncommon. There are patients who make dosing mistakes by taking monthly dosages. That's why I prefer daily doses, because it's much harder to reach toxic levels. And if there's any problem with toxicity, you can stop the supplementation right away. If you've taken a mega dose, your body will take longer to metabolize it. If you have digestive conditions that compromise absorption, if you've had gastric bypass surgery, or if you have a large excess of fatty tissue, then you'll need higher than standard doses to raise your levels. Lab tests still lack a universally agreed optimal range, but it keeps expanding. Groups of professionals, as shown in a recent review, argue that levels between 40 and 70 offer better protection against chronic disease. To achieve this, in most cases, daily doses of at least 4,000 units per day are needed. These same authors, Richard Cheng's team, claim that raising population levels of vitamin D would, pay attention, reduce the incidence and mortality of 8 out of the 10 leading causes of death in the United States. Different ranges of vitamin D are needed to achieve protection against different diseases. For example, to achieve musculoskeletal benefits, is it enough to reach 20? To prevent secondary hyperparathyroidism, it's best to stay above 30. But to achieve a better immune response or cardiometabolic prevention, it may be necessary to reach 40 or 50, as you can see in this image. Other expert groups are much more aggressive, proposing optimal ranges between 40 and 60 in lab tests, and daily doses of 7,000 to 10,000 international units per day for people with obesity and other comorbidities. So what's my position? Although there is some evidence supporting levels between 40 and 60 ng/ml or even higher, the benefit of following this guideline is still not entirely clear today. However, we know there's no harm in being within that range, and if you think about it, we have a possible benefit and no harm. Therefore, I would recommend being pragmatic. Actively avoid levels below 30. Do you have obesity, insulin resistance, cardiovascular disease, cancer, type 2 diabetes, or an autoimmune disease? I would aim empirically to go above 40 if you ask me. Personally, I try to keep my levels between 40 and 60 since the benefit-risk ratio of this action is high. After extensive study, that's the decision I make for my health, though it's not a general recommendation. Vitamin D is still one of your main tools in preventing chronic disease, although we still have a lot to learn about this wonderful molecule. We shouldn't be passive or unconcerned about its levels, since optimizing for health is a daily journey in which anything that keeps us away from disease and death is welcome. Share your thoughts on the video in the comments, and I'll see you next time. Most importantly, I suggest watching this video where I challenge the Endocrine Society's guidelines.